Welcome to ACE's Health Podcast, where we approach health from four essential angles: anatomy, chemistry, energy, and the soul. I'm Dr. J.D. Young. Today, we want to talk about something that has been making headlines: President Biden's diagnosis of prostate cancer. But this isn't just about a political figure. This is about widespread misunderstanding in both medicine and the public between advanced and aggressive prostate cancer. They're not the same thing, and understanding the difference can save lives. In medicine, we often use words that sound similar but mean very different things. Advanced prostate cancer refers to how far the cancer has spread. It's about staging. If the cancer has reached lymph nodes, bones, or other organs, we call it advanced. It's a static snapshot, a map. Aggressive, on the other hand, refers to biological behavior of the cancer, how fast it grows and spreads. We use tools like a Gleason score to measure that. A Gleason score of 9 or 10 tells us the tumor is poorly differentiated and fast moving. So here's the key distinction. Aggressive cancer may still be localized, but will likely spread quickly if not caught early. Advanced cancer is already widespread, but could have taken years to get there if it's slow growing. Of course, these two can overlap, but they're not the same thing. Now let's apply that to Biden's case. Reports say his cancer has already metastasized to the bone. That's clearly advanced. But the press is emphasizing that it's aggressive, not just advanced. Why? If it is aggressive, it suggests it grow and spread rapidly, possibly within a single year. But if that's true, we have to ask, wouldn't that have had a symptom earlier? Wouldn't his medical team have caught it? After all, any man, especially a sitting US president, with early urinary symptoms would be evaluated thoroughly. But if it wasn't aggressive, and instead it's just a slow-growing cancer that was present for years and only recently reached the bones, then the concern is different. Why wasn't it detected earlier through regular screening? Either way, we're looking at a missed window, whether the cancer was undetected for years or developed rapidly and symptomatically, yet wasn't acted upon. Can aggressive prostate cancer rapidly spread in 1 year? The answer is yes, but rarely. Highly aggressive prostate cancers, those with Gleason 9 or 10, can metastasize to bone in 6 to 12 months. But this usually produces very obvious symptoms. For example, low back pain that gets worse, hip or leg pain misdiagnosed as sciatic, sudden worsening of urinary symptoms, rapid PSA elevation. For patients with constant medical supervision like President Biden, it would be highly unlikely to miss these signs for an entire year. This leads us to a more likely conclusion. The cancer was not necessarily aggressive in pace, but rather advanced in stage, and had likely been there for several years, undiagnosed or unmonitored. Why does this distinction matter? Because if the public believes that prostate cancer can go from 0 to bone spreads in 1 year without symptoms, we create panic. Men may rush to get PSA tests and even without risk factors or symptoms. This can lead to overscreening, overdiagnosis, and overtreatment. Many prostate cancers are indolent, meaning they grow so slowly that they never cause problems in a man's lifetime. We don't want to create fear that every prostate cancer is a ticking time bomb. At the same time, we also don't want to miss aggressive ones. This is why we need clear guidance, not a blanket rules. So, who should get screened regularly with PSA tests? Here's what I recommend. Men aged 55 to 75 with more than 10 years of life expectancy. Men with a family history of prostate cancer. African American men who face higher risk. Anyone with urinary or pelvic symptoms. Men with rapidly rising PSA values. And if your PSA is rising quickly, even if it is still normal, it's worth further investigation. But a single high PSA number doesn't mean surgery or radiation. It means further testing with MRI, biopsy, or clinical evaluation. Let's close with some practical ACEs-style advice. Anatomically, please pay attention to physical signs, pelvic pain, bone discomfort, back stiffness. Don't write off as age. Chemically, track your PSA history, testosterone, inflammatory markers, combine lab data with symptom awareness. Energetically, don't ignore fatigue, weight loss, or unexplained discomfort. There can be signs your system is under chronic stress or something deeper. Spiritually, as men, we're taught to endure, but listening to your body isn't weakness, it's wisdom. Talk to your doctor, your partner, your family. Preventative care is an act of strength. We don't need fear, we need clarity, evidence, and empowerment. Prostate cancer can often be managed. Sometimes it doesn't even need to be treated, just monitored. And sometimes it does need swift, decisive action. The point is, know the difference, ask the right question, and act wisely. Thank you for joining me on the ACEs Health podcast. If this episode helped you or someone you care about, share it, subscribe, and join us next time, where truth, wisdom, and medicine meet.